Hey, it's Chris from chrisbeatcancer.com, and I'm here with Dr. Leigh Erin Connealy from Cancer Center for Hope, and she's one of the speakers this year at the Cure to Cancer Conference, and also she and I were part of Kevin Gianni and Renegade Health's Healing Cancer World Summit a couple years ago, and it's great to finally meet you and pull you into the conference room and do a little talking. So something you should know, she has worked closely with Dr. Contreras at Oasis of Hope. I know a lot of my people, a lot of you watching this probably already know who she is, but if you don't, she's an integrative MD. She is a cancer doctor, and I'm excited just to hear what you have to say about your journey and treating cancer and some of the stuff you mentioned in your talk yesterday. So we'll just get into it. Thanks for doing this.
Oh, you're welcome. And it's great, Chris, because I know that you've been through your own journey and challenges. And I always tell people your mess becomes your message.
That's awesome.
And, or the other word I always use, your poison becomes your passion. And so both of us are
steal
here.
Those?
and so both of us are here today because we've had a mess and we've also had a poison. And so people, you are not awakened until you have pain and you have problems.
Yeah.
And so then you become curious about what you're going to do with your life. And so
problems force you to make tough decisions, right?
Exactly. So so you're probably wondering why I'm doing what I'm doing.
Yeah. How does it, I mean, this is what fascinates me, because there are so many oncologists that are conventionally trained that just stay in that system, and they stay in that very rigid model of medicine. What happened with you to kind of take you where you have lead you to where you've ended up? Right.
Well, an oncologist, they have to do those treatments, Chris. They have to do surgery, chemo, radiation, or some combination. That's what their recommendations and plan for their patients has to be. Okay. So yes, there are doctors, integrative doctors, and there are integrative oncologists who have incorporated conventional oncological treatments with all kinds of what they call complementary alternative medicine.
Right.
And so worldwide, there are oncologists, conventionally trained oncologists, who practice what we call integrative medicine, which is combining the best of their specialty, whether it's general medicine or oncology or gastroenterology, and combining it with all the complementary alternative treatments. And we know that if doctors do that the patient outcome, the patient feels better and their outcome is significantly better. The doctor of the future, and I'm talking about in the next hour and tomorrow, will incorporate this combination of conventional Western scientific methodology, combining it with all the treatments, because doctors are learning right now as we speak, because right now as we speak, it's there's an integrative oncology conference going on that part of my staff is attending to learn things that maybe we need to implement next week.
Yeah.
And so there's doctors learning it. It's not something that a doctor can learn in a weekend course, though, because this is very complicated, and if you're treating patients, you always want to do the right thing. And so, but they can learn, and they learn over time, and then they start incorporating these methodologies, and they see, oh, wow, this works. My patient is getting better.
Hey, but you're still in the minority, though, right?
Yeah, we're still in the minority, because doctors today, when they go to medical school, they learn basic sciences, and then they learn pharmacology, and pharmacology is utilization of medications and prescriptions to a patient. So in a doctor's toolkit today, they basically have, okay, we're going to do a quick history and physical, and I say quick because unfortunately that's the way doctors are reimbursed. They don't have time and hours to discover and peel the onion of a patient, and then they give a medication because that's what they know.
Right, that's what they're trying to do.
And I know how to do that too. I know how to use medications, because sometimes when a patient comes in, we need to utilize medications, Chris.
Yeah,
and
I understand that.
And so we have to do that because there are emergency situations where medication is necessary. And but when the patient has this problem, a doctor should be saying, why are you having this problem and what is causing this problem? And so, because why do you have high blood pressure? Well, 5 years ago I saw you and you didn't have high blood pressure. So something had to change in you.
Yeah.
That
Isn't it just because they're not taking statins?
Well, statins, we don't have a statin deficiency, unfortunately.
Yeah.
So that's a whole nother discussion. That has been probably the greatest hoax of America is patients taking statin drugs.
They're very dangerous.
They're very dangerous, and they may have some medicinal effect in some patients, but overall, I always tell people, if you can find something natural that will do the same thing, that is really the way to go. And so now, sometimes in severe patients, sometimes they may need a low-dose statin. Maybe just every individual is an original.
Yeah.
So how you treat people is very unique to their composition. So, you know, just like you do your fingerprint.
Yeah.
Your fingerprint's unique. No one else has your fingerprint. Well, your insides are exactly the same way.
Well, I'm so glad you said that, because I feel like from the patient side, a lot of patients are treated like cattle in the industry, and they're not treated uniquely, and they're not considered as a unique person with a unique set of problems. They're really just kind of shoved into a treatment mode or model, and you know, it kind of leaves you feeling like doctors don't care about you, right?
Yeah, like, wait, does he really know me? Is he really taking the time to see who I am?
Yeah. Did you make a joke about the doctors not even know your name? Was that you?
Yeah, well,
Yeah.
it was interesting because one of my mentors, Bill Curry, and he's dead now, but he was 69 when he died. He was diagnosed at 21.
Well, yeah, that's awesome.
So 21 and
diagnosed with cancer.
He was diagnosed with a very serious cancer. Bone cancer is not something that's very difficult to treat. And so when he went in to have they were going to amputate his leg because, you know, 50 years ago, that's what you did. And so he asked the doctor, he says, well, do you know my name? And the doctor didn't know his name. He says, I'm out of here. I'm signing out AMA. I'm gone. So then Bill went on a circuitous journey to heal and fix himself.
Yeah.
And he lived until he was 69, and he died 3 years ago in January. And I had the opportunity and privilege to meet him 17 years ago. I was at an integrative medical conference, and I met a gentleman by the name of Burton Goldberg.
Oh,
You
yes.
probably know Burton Goldberg.
Burton's here at the conference.
Yes, and people should know Burton. Burton's
Yeah.
87. He started a magazine called Alternative Medicine. I don't know if you're probably too young to know that
No,
magazine.
I didn't.
He started a magazine called Alternative Medicine Magazine, and it was a magazine for the layperson to know about all these treatments because he had personal experience with these treatments, and he says, oh my goodness, I want people to know about this. And so now, at the age of 87, he knows something, because at 87, you know something.
Yeah, you learn a couple
And
things.
so he said, so I always wanted to meet Burton Goldberg. And I went up to him and I said, Burton, I said, I want to meet you. And so I met him, and we've been friends ever since. But he said, Leigh Erin, I want you to meet this guy. So I met Bill Curry, and Bill Curry tells me his life story, and he was crying with me, and then I said, well, let me tell you my life story. So we were crying together about our life stories.
Yeah. And was that, at that point, were you practicing? Were you in...
I was practicing
were
integrative medicine.
You were already
yes,
practicing?
I was already practicing.
That's great.
I had a nutritionist in my office from day one.
Really?
So that was
you
29.
You knew in med school that you wanted to I mean, right?
Well, I knew.
Pretty close to it?
I definitely, I was there, okay? And then, but I had to learn I had to learn what we were taught in medical school because you need to learn that to understand what you're going to do.
Yep.
And, but then early on when I opened my practice, I knew I needed a nutritionist to help me do what I wanted to carry out.
Yeah.